we've given you a whole lot of information over the last few hours. As I said, as we've been saying, it's drinking from a fire hose in terms of learning how all this stuff works and how it operates, because it's very different, obviously, than when you were employed and you only had like 2 or 3 options of health insurance plans that you could get from the corporation. So, what the heck do I do now? So, you have a few options. Step number 1, you should do what Paul talked about, which is getting that Medicare and You, and this is 2022, but just over the last week, they issued the new version of it. So familiarize yourself with Medicare and You 2023. Learn about the different options, and you've taken the first step by taking this, seminar right here today, so that you can figure out what is the best for you as you move into this new world of Medicare. The choice you make rolling in the first time can limit your flexibility, as Paul talked about, for the rest of your life. So what you do during when you're 64 and a half till 65 and a half, basically can lock you in on certain things going until, for the rest of your life. So the decisions you're making now are incredibly important. The old caveat emptor, buyer beware, make sure that you do your homework as much as you can. So 1, educate yourself. So step number 2, you have a decision before the decisions. You can do this all on your own. If you're knowledgeable, if you have the time and you feel that you have the expertise, you can figure this out all by yourself. No problem at all. And many, many, many people do that. But you can go through these consultants if you so choose. So if you do it yourself, you can do it yourself, or you can get expert opinion, expert advice. So you do it yourself, you'll have to decide whether you want to do Medicare and a Medicare supplement or Medicare Advantage. And then you'll need to research the different plans that are out there and decide which one is right for you. And remember, with all of these things, I don't know that Paul even mentioned it, when you were under your employer healthcare plan, you did it for yourself, your spouse, your family. That was basically you made a choice, and you individually, your spouse or your family was covered by the same insurance policy as you chose. On Medicare, you're 2 individuals. Spouse or a retiree can have 1 set of plans, and your spouse can have the same plans or can have very different plans. One can be traditional Medicare, one can be Medicare Advantage. One can go with AARP, the other with Humana. Purely, you are 2 individual people. You will be charged 2 individual premiums. You'll have to pay that $170 and $171.50 for you, and then one for your spouse, totally separate. Yeah. So the complexity, even for that, is a lot greater than when you were under an employer plan. Because employer plan, you paid 1 set of premiums, for hospitalization, medical insurance, drugs. It was all covered under one thing. The diverse decisions you have to make now as at age 65 is a lot greater. So you can go with an expert, and there are a few different places you can go. So one of the things we really haven't talked about is something called MAP, which is the Michigan Medicare Medicaid Assistance Program. This is a federally funded program under, there's an organization in Michigan called Area Agency for the Aging, and these organizations are countrywide, but in Michigan they're called the Area Agency for the Aging, and under their umbrella is an organization called MAP, and this is a set of consultants who are volunteers like you and me, but they get certified and they can assist you with everything we've just gone through. They can't really help you that much on the Chrysler Stellantis benefits, the HRA and the RICA, because that's really unique to us. But for all the Medicare issues, Part A, Part B, Medicare Advantage, Part D, Medigap, they are experts on this. The big difference between them and some of these other consultants we'll talk about in a second is they are unpaid. And there is no, so all the other consultants are private entrepreneurs or corporations, and they are getting paid not by you individually, but by the premiums you're paying. The insurance companies are giving them a finder's fee or a service fee for this. The MAP people don't get that at all. So they are, and they can't sell you the insurance. They will advise you, but they will not sell the insurance to you. You'll need to do that on your own based upon the advice and the assistance they give you. So they are not, so the MAP people are not insurance agents, but they are experts on this. So they are available, but we also have, there are many insurance agents who are in the business to assist people as they turn 65 and even, in their 60s, 70s, and 80s to assist them through this complex process. NCRO has identified 3 of them over the years that we have relied on. So let me go back. So the MAP people, we do have a representative in the back of the room. Her name is Loretta Mack. And after this session is over, she will be able to talk to you, if you so choose, to learn about their services and how you can contact them. But we also have in the back of the room one of the agents organizations that we have used for years called Butler Capital Advisors, and representative from their organization, Dave Baum, is here with us today. We also have 2 other organizations or agents that we've worked with, Double Health USA with Dave Key and Laura Camacho, who is a Medicare consultant on her own. They are also there available for your assistance, but they're not in the room today. And then, as I said, Stellantis has contracted with Via Benefits on that side of their business to assist you as an agent. So in our package here, we have a slide for each one, and some of this contact information is also on your on the agenda that was provided to you. So the MAP people are right there, and as I said, it's a nonprofit organization, and there's an 800 number to contact. We also, as I said, have Butler Capital Advisors, and I was just advised that they just updated their process this year, where it used to be that you had to contact them and do things by paper. They've set up an electronic process. You can go on their website and fill in a form through their website, so it's a little bit more high tech. Double Health is also available. This person, I think John said she lives in Austin, Texas. Her name is Laura Camacho. And also Via Benefits, who's the one contracted by Stellantis. So there are contact information from all of them, both their website and their telephone numbers. So that is purely up to you in terms of whether you contact none, one, as the gentleman said, you can contact a few of them. After you individually or they assist you in sort of, winding through this very complicated maze, you then have to actually hit the button. You need to actually enroll in these different insurance policies, either online or in paper. You need to start paying your premium, either sending a check on a regular basis, or you can set up an electronic process through ACH, Automated Clearinghouse, so that it can be deducted out of your checking account on a monthly basis. It was even asked, or a question was asked earlier, you will receive a Medicare card. Over the last few years, they've changed that a little bit. It used to be your Social Security number on your Medicare card, and that's changed about 3 or 4 years ago, where it's now this very alphanumeric, non-rememberable number for security purposes. So you don't have to, when you walk into a doctor's office, give them your Social Security number. You just give them your Medicare card. Also, by the way, if you are on Medicare Advantage, you really don't, you need to keep your Medicare card in your wallet, but in general, the hospitals and doctors will only ask for your Medicare Advantage card because your claims do not go through CMS, the Center of Medicare and Medicaid. So if you're on traditional Medicare and with a Medicare Advantage, you basically are covered by 2 insurance companies, at least, well, really even 3. You'll have Medicare, Part B, and you're part of the, you'll get your claims and your EOBs, explanation benefits, through the government website. You'll then get an EOB from your Medicare Medigap, and then you get another EOB from your Medicare Part D. If you're under Medicare Advantage, all you get is one, I believe, one EOB from your Medicare Advantage insurance company. So Medicare Advantage is much more similar to the process we used to have at Chrysler or Stellantis, where basically you've got one, whether it's, I've got HAP, Humana, whichever insurance company you have, you basically have one contact information or one contact, which is that insurance company. If you're under traditional Medicare, it's kind of split into a lot of chunks. So it gets a little bit paperwork process-wise, keeping track of, a little bit more complicated. So you'll get a Medicare card and you'll get your other insurance cards. You might have to carry 2 or 3 with you. And then there's another 2 or 3 for your spouse. And then on Medicare and various insurance companies, you want to set up a user ID and password, so that way you can get your EOBs electronically as opposed to getting them in the mail, because it's just a lot faster. So good luck with your decisions on this. And we now are open to any questions at all related to this. It's the end of our formal presentation. So if you have any questions in general, we're really not here to answer any specific questions about your particular situation. We want questions that are kind of generic to the entire audience, both in-house here and probably the 50-odd people that we have on the internet. But if you have any questions, please let us know. Sherry.
I just wanted to mention, take snacks on your way out. There's a bowl there, and then there's some on the counter. Water, juice, chips, whatever. Thanks.
Very good.
Okay.
Oh. Who says there is no such thing as a free lunch? So, Sherry, do we have a microphone for John? Oh.
Hello.
Oh, go ahead.
This isn't a question as much as a comment. One thing I think you missed, and maybe I was daydreaming, but my wife is younger than I am. So when I went on to Medicare, she was left behind, but Chrysler kept her
Absolutely
insurance, and I don't know that you mentioned that or not. But
no, I didn't specifically mention.
Yeah,
it, exactly.
and so spouses are not always. We're not necessarily always on the, on Social Security or Medicare at the same time.
No, absolutely
So,
not. You're 2 individuals.
And in my case, my wife has a chronic disease, and her medication is just outrageously expensive.
My wife is on medication. It's $130,000 a year.
Yeah, and so it's its own set of issues. But I think it's really important to understand that when you break away from Chrysler's insurance, you break away. If your spouse is younger, she or he does not.
And it can happen the opposite way,
right?
That the retiree is younger than the spouse. So you as the retiree might go onto this whole process at 65, but your spouse, your spouse can hit it first and you hit it second. So it, depending upon how the ages are different between the retiree and the spouse. Absolutely.
Well, I'm kind of in it to win it personality. And I burned out with WageWorks. I just admit that right now. So what can you tell me specifically will stand, or where I can go to find out what will stand as proof that we have paid medical expenses so that we can claim against old HRA money that's just sitting there in our RICA account?
So the presentation we gave you here on via benefits, we very intentionally only talked about the enrollment process. There's a whole nother set of slides. We didn't want to confuse you with facts on how to actually do reimbursements. And it's another 10 or 15 slides of the actual process to get the reimbursements. Those slides, A, are on our website, those additional claim processing slides. And also, I believe when you do turn 65, you will get that information from Via Benefits, I think. So our advice is go on to the NCRO website that we've given you, and it's on the agenda here, and go onto our page, and you should be able to find that. It was a very nice, very extensive presentation that Via Benefits gave us December of 2021 and January of 22 as we made this switch. That will go through very extensively how you do the claims processing part. But no, we intentionally left that out because we didn't want to confuse people. I'm not sure whether one of these links is it or not. I'd have to look. But I can even show you later on in terms of exactly the link to go to. Yes, ma'am.
I actually have two questions. One is regarding Social Security. Has anyone in this room taken their annual wages that Social Security tells you you have earned and verified it against their W-2s? Or do you just trust that it's correct?
You can. I mean, absolutely.
Have you done that?
I personally have not done that because, so the question is whether, because you can go on the Social Security website and it shows what your earnings have been every year for the last, 30, 40 years. The question was, have we individually gone and verified those numbers? Number one, you certainly can do that, and hopefully if you're with a large corporation, it's pretty guaranteed that those numbers are accurate. If you're with a smaller entrepreneur or a smaller corporation, and the HR department or the finance department was a small group of people, it's possible those numbers could not be accurate. So you should verify it. Realize also that because there are caps and things like that, that it can get a little, the laws changed over the years. So what your W-2 wages are not necessarily what your Medicare and Social Security wages are. So
I started doing it and found so many discrepancies. I was like, I just wondered, does anyone do that?
well, and then there are Medicare wages also, which are different. So
Okay,
if
so
you want to
basically
do that
trust it.
verification, more power to you. If it's with a large corporation, I would trust that those numbers over the years were accurate. But if you want to verify it, go for it. And you can probably talk to Social Security often. And another thing we didn't say here at all, if you're going on to Social Security, all right, so going on to Medicare, everything we sort of explained helps you in that Medicare process. If you're going to Social Security, I would really advise you to do two things. One, set up an account in Social Security and see what all the Social Security rules are that apply to you. Because for Medicare, we all pay the $170 and things are very standard, but Social Security is all unique to you and to you and to you. Because of your wages that you earned over the years, and also your marital relationships. If you're still married, if you're divorced, if your spouse was deceased, all these different sets of rules. So set up an account in Social Security. They have really upgraded the Social Security website, so it gives you a nice, used to be that you would get a Social Security statement mailed to you. Now everything is electronic. It's really neat. That's number one. And number two, if you've got a very complex marital situation over your years, I'd really advise you to set up an appointment with Social Security and have them with you and your spouse actually sitting there in the room with a consultant or with a Social Security employee and step you through your individual situation.
Thank you. My second question is about EOBs. I get them now, and I'm thinking when I join Medicare, I'm going to get 3 sets. What do you guys do with your ELBs? I mean, what is the purpose of them? I understand the purpose and I understand what they're telling me, but I don't get why. Do you keep them? What do you do?
Well, the EOB, my wife and I have a very elaborate system. My wife's the bookkeeper in the accounts payable department. I print off the EOBs and I sit there and I print off a piece of paper and I give them to her, and she puts them in a file and then waits for the invoice coming from the doctor. And we make sure that the invoice from the doctor saying you owe $37.50 is, is on the EOB. It says how much you're responsible for paying. Because the doctor's office will initially charge you, $500 or $1,000 or something, whatever his list price is, because they haven't gotten the insurance payment. So we sit there and just wait for the doctor's bill to now equal $37.50. We then pay that amount of money, staple the two together, and file it and keep it for 7 years or so or whatever, and then you can, have it shredded.
Thank you.
Mm-hmm. Because also with these EOBs, you get, again, if you're on traditional Medicare, you get a Medicare EOB and you'll get a Medicare Medigap EOB. So again, the doctor's office will get two payments, and therefore, based on when they invoice you, they might not have got. We also get some of these EOBs could take a year or two sometimes to clear through their systems. It's impossible. Yes.
I'm going back to Social Security. I'm glad you brought that up because I have a Social Security question. Like I said, I'm 66 in I don't know how many months, and I'm not on Social Security yet. I'm actually waiting to make a decision. I don't, and I'm, that's
you don't have to go on Medicaid, Social Security until age 70.
Right. I know, but everyone's situation is different, and I'm waiting to decide and trying to figure out when to pull that switch or whatever.
Mm-hmm.
But when I went to the Social Security website to get an estimate of my monthly benefit, you mentioned that it goes up some small amount every month.
Well, so there's your retirement age, which I think currently is 66 and 4 months,
right.
And it keeps changing every year, and it's going towards age 67 as year by year for the next 5 or 6 years. This was a law that was passed back 30 or 40 years ago. After you reach your retirement age, whatever that is, your Social Security will go up, I think, 8% a year.
A year, right?
8% a year. Your benefits will increase up until age 70. Once you hit age 70, it caps out.
Right. But that year is broken down by something more than or less than a year.
Yeah, well, it's by
And
by
you
month.
mentioned it's by month.
Correct.
Okay. Well, when I went online and did that check, it was only increasing. The increasing amount wasn't every month. It was like every 3 or 4 months. And I'm just wondering if you happen to know if that's an anomaly of the tool or whether, in fact, it goes up every month.
I thought it was going up every month based on it was prorated, so 8% divided by 12.
Right.
Is my guess.
Yeah.
But
well, it was.
I really haven't looked at that level of detail.
It was not doing it by the month.
Maybe they just do it by quarter instead of by month. Up an appointment with Social Security.
Yeah, okay.
They have offices in this area, about 5 or 6 offices. One is in Clawson, another is in Pontiac. Set up an appointment and meet with them. It takes you can go in and first come, first serve. But the line can be kind of long. I'd really advise going on the website, set an appointment. It usually takes 2 or 3 weeks, but then you actually can see your particular situation. Also, they are so security conscious that if you do not have your spouse there, they will only tell you about your Social Security, not your spouse's. Even though you say, well, it's just my spouse. No, that spouse has to be there at that time in order for them to give you any information about both of you guys. Mm-hmm.
I have a few questions from the web. Sorry. John, you want to go first? Okay.
Guys, we're still in session here, please. Guys, hold on a second.
Sorry, this is just for the folks on the webinar. There might be something of interest to you. If I go on Medicare in November, do I need to inform Benefits Express so that they don't take money out of my pension for insurance?
Oh, good question. That should be, I don't think you need to contact them. I believe that there is coordination between Benefit Connect and the corporation and, well, guaranteed, as soon as you go off insurance, they will cut you off insurance and they will take the deduction out of your, the deduction that they're currently making out of your pension check will stop.
They drop you like a hot potato.
Yep.
Okay, I am in my 70s, live in Florida. Can I use the folks that you mentioned as far as that help to help get with my prescriptions? And the answer is yes.
So the two caveats there are, the consultants have to be certified in that particular state. Now, David said that he's registered in all 50 states, but you have to talk to the consultant to see whether they are registered in your state. Also, not all each consultant does not necessarily sell all the products. So you could go on Medicare.gov and see the different products, different insurance policies that are potentially at your disposal, but the consultants that you have, that you can contact with, might not be able to sell you that insurance policy because they have not registered with that insurance company.
So ask the question.
Yep.
I will be 65 in April, and my wife, being younger, will continue FCA insurance in 2023. When I sign up this fall with Benefits Express, should I sign up for family insurance or individual insurance for me and my wife separately? Should I sign up for HDHP slash
High deductible,
HSA plan
yeah.
or PPO plan, especially because I cannot contribute to the HSA after April?
So there are some very specific
long
rules when this happens, depending upon who hits 65 first. What I advise you to do is when the open enrollment period occurs with FCA, contact Benefits Express and they will be able to tell you exactly what situation exists for you particular. Because there's one set of rules if the retiree hits 65 first, and there's another set of rules if the spouse hits 65 first.
And we're sorry to the folks on the webinar that we couldn't send them snacks. I don't know what you guys are thinking. You should email a box to everybody.
A goodie box, okay.
A goodie box. My wife will go on Medicare before me. Does my Chrysler healthcare premium automatically change to single person rate at the month she is 65?
Yes, I would advise you, if
yes.
you're, if a one of you is going to be turning 65 in the next year, I would advise you to, when you do your annual enrollment, let's say you're both 60 or 162 and 164, and you're signing up for insurance this fall, talk to Benefit Connect and say, okay, I'm going to be turning 65 in September of 2023. How does that affect my pension check in August, September, October of 2023? So they should be able to tell you ahead of time. I mean, yes, you can actually figure that out once you hit 65, but much better when you're enrolling this year to sort of know ahead of time how that's all going to be working out. But it should work, but that way you get a little bit of a guarantee of what will happen, 9 months or 12 months later. And is that it? That's it from the web? All right, John?
Yeah, I'm going to take less than a minute because Howard triggered a thought. Some time ago, I had a friend pass away, and the wife went crazy trying to sort everything out. And I wrote for the website, Survivor Guide. Write that down, Survivor Guide. Because in doing that guide, I had to explain everything. If the wife dies first, or excuse me, the spouse dies first, retiree dies first, when you both die, what happens, what you have to do. So look at that Survivor Guide. It was mailed to everybody.
Yeah. So it's not just the Survivor Guide, but also it is incredibly important for all these things to set up beneficiaries, so that when we all pass, that you're not only Survivor Guide is for your beneficiaries ahead of time, but once you pass, those beneficiaries, whoever they are that you told, your pension or your 401k or your RICA, that can't be changed. That's it. So another thing that NCRO offers is a class, we just had it about a month ago, for estate planning. Incredibly important as we all age. So make sure you have an estate plan and making sure that your beneficiaries are set up appropriately such that whatever happens after you pass are exactly to your wishings. Thank you so much, everyone, for coming. And any additional questions, you can stick around afterwards or else send us an email at inscom@ncro.org. Thank you so much for your time.